of is transferred to Friday due to the load of work that we have. But good, we are all here again, and the Director of Africa CDC, that's the acting director, Dr. Ahmed Okwue-Ouma, is here to brief us. As usual, the director will be providing updates on, one, the COVID-19 situation on the continent, as we're aware the pandemic continues, and then other health emergencies, outbreaks that are happening, including the Ebola outbreak in Uganda. So then there will also be a special focus on the CPHIA event, 2022 event that's to kick off just this weekend in Kigali, Rwanda. There will be a special focus on how far the preparations are and what do we expect in the coming week. So not to take off much of our time, let me bring in our guest, our host, the Acting Director of Africa CDC, Dr. Ahmed Okwue-Ouma. Director, it's over to you for your briefing. Thank you.
Thank you, Nick, and good morning, good afternoon, good evening, wherever you're joining us from. So for today, I would like to cover 6 things. 5 public health events of concern on the continent, and then the international conference on public health in Africa that starts this weekend. The 5 public health events of significant concern are COVID, the Ebola outbreak in Uganda, the multi-country monkeypox outbreak, the multi-country cholera outbreak, and Crimean Congo hemorrhagic fever also in Uganda. But let's start with the COVID situation on the continent. So, and today we'll make it a bit of a summary so that we can have time to discuss a little bit of the others as well. To date, we are at 12.1 million of the number of cases documented. We are at 95% recovery, that is 11.4 million. And unfortunately, we are at 256,223 deaths, which is a case fatality rate of 2.1%. And we still make up about 4.1% of the global deaths due to COVID. I'll skip the 1-week trend and I will focus on the 4-week trend, because this gives us a better feel of how the pandemic is evolving, particularly now that we are preparing for the holiday break in most parts of the continent. When we look at the 4 weeks before today, we see that there is an overall average increase of 8% in the number of new cases that are being reported. 8% average increase over the last 4 weeks. And this is significant because when we compare it with the number of deaths over the last 4 weeks, these stand at 2%. So the number of cases are up 8%, and the number of deaths are up 2%. The reason this is significant is we are going into the holiday season and we see pockets of increases in infection. And so it is something that we need to put as part of our planning as we go into the holiday. And one key thing we need to do is vaccination against COVID-19. To date, we have received 1.064 billion doses of COVID-19 vaccines from across many sources. And we have administered 818 million doses of these vaccines, making it a 76.9% rate of administration. So we are consuming what we are receiving. You will also recall that for the last 2 weeks, we have been readjusting the way in which we look at the vaccination rates on the continent. And we took the decision to use target population because these are the individuals we intend to vaccinate. The very young are therefore not part of this calculation that we are having. And different countries on the continent are using slightly different target groups. There are those who are doing 12 plus, there are those who are doing 15 plus, there are those who are doing 18 plus in terms of a target population. So as Africa CDC, we are working on the averages of the target populations, and the situation on the continent today is as follows. Using target population as the denominator, Africa has fully vaccinated 44% of the target population. And I repeat, using the target population as the denominator, Africa has vaccinated 44% of this target population. The second important result out of the re-analysis is that 13 member states have passed the 70% mark for target population. So 13 of our member states using target population as a denominator have actually passed the 70% mark. And these countries include Mauritius, Seychelles, Rwanda, Comoros, Tanzania, Somalia, Liberia, Cape Verde, Morocco, Botswana, Mozambique, Zambia, and Sao Tome and Principe. So going forward, we will be giving you figures which are relating to this target population. The message here is that we have been doing a lot of work in the background, including through our Saving Lives and Livelihoods initiative, and the result is good. We are seeing very good progress with the vaccination rates that are actually going up. Our Saving Lives and Livelihoods initiative continues. We are working with all
Sorry, colleagues, we're internet, of course, technology. So we've just lost the director's connection briefly. He's making efforts to rejoin us. Okay, he's back. The director is back.
Yes, there was an interruption in the internet where I am. Yeah, so I was saying that when we look at the number of doses that the AVAT mechanism has delivered on the continent, we currently stand at 121.6 million doses to 38 of our member states. And we also have delivered 732,000 doses to the Caribbean countries who we've been supporting in accessing these COVID-19 vaccines during the height of the challenges we had with access to vaccines. So in essence, the Saving Lives and Livelihood Initiative is doing very good work at country level, supporting vaccination rollout and also purchasing of the necessary COVID-19 vaccines. The second public health event of concern is the Sudan strain of Ebola virus in Uganda. And since the last brief, no new confirmed case, no new deaths have been reported in Uganda. It has been 9 days since the last confirmed case was reported. You recall we discussed a bit how this was a situation of a survivor delivering a baby that was having the infection, and unfortunately the baby lost its life. So it was a special situation because the mother had actually already undergone her period for quarantine. But nevertheless, we count afresh, and it's 9 days since the last confirmed case was reported. And there is an indication that the community engagement strategies that we have put in place, supporting the government of Uganda, particularly in the areas that were epicenters, they are not only working, but they are giving us very concrete results that we can be able to report even within a week or two. Those strategies are actually working. So from the beginning of this outbreak, we've seen that cumulatively, we have reported 142 confirmed cases, 56 confirmed deaths in 9 districts in Uganda. We are continuing to support the government in community engagement so that we can truly bring this Ebola outbreak under full control. Very good coordination from the government of Uganda internally and also with partners, and we are quite happy with how it is proceeding. For the vaccines trials, the first doses have actually arrived in the country, and we are waiting for a schedule to be shared by the Minister of how the clinical trials are going to be rolled out. Again, another very significant milestone that we are almost reaching a product that we can confirm that is working at the community level. So we're really looking forward to the results of these clinical trials. The third is the multi-country monkeypox outbreak. When we look at the situation on the continent to date, since the last briefing, 42 new confirmed cases and no new deaths have been reported in Nigeria and Sudan. This is a 17% decrease in the number of new confirmed cases and a 100% decrease in the number of new deaths. So again, we are quite encouraged by the evolving situation of monkeypox here on the continent. Cumulatively, from the beginning of this year, we have seen 1,089 confirmed cases, 202 deaths from mpox, and these have been reported from 13 of our member states. And this means that the continent has unfortunately lost 1 in every 5 confirmed cases of monkeypox, which is a concern, and we really need to bring this under control as soon as possible. However, of the 13 member states, 3 carry the largest burden, and that is DRC, Ghana, and Nigeria. The 3 countries account for 94% of all the confirmed cases for mpox here on the continent. At Africa CDC, as I said last time, we received a donation from the Republic of Korea for 50,000 doses of second generation smallpox vaccine, which is effective against monkeypox. And we are in discussion with others to see if we can be able to get more of those vaccines, and we get our healthcare workers in the front line vaccinated, and also the communities that are affected to be also be vaccinated. So very, very good point to note that we are engaging others, and there is willingness for this to be able to be shared. It has come a bit late, but really this kind of sharing should be the norm at the beginning of any outbreak, so long as tools like vaccines, therapies, and diagnostics are available. The sharing should be early so that the numbers are kept in check. The fourth that I would like to share today is a multi-country cholera outbreak. And on the 5th of December, His Excellency, the President of the Republic of Malawi, declared the ongoing cholera outbreak in Malawi as a public health emergency within the country. We have mobilized ourselves to provide key support to that declaration, and we are working very closely with the Ministry of Health there to deploy the required expertise and infrastructure that is going to support control of the cholera outbreak in Malawi. Since the last brief, 488 new confirmed cases and 15 new deaths of cholera have been reported from Malawi itself. And over the last 4 weeks, we have seen a 61.3% average increase in the number of new cases. So this is truly a concern, and we are going to work very closely . Apologies for that. We've seen displaced individuals within countries also contributing to the challenges of bringing cholera under control. The final is the Crimean Congo hemorrhagic fever in Uganda. We have documented 1 new confirmed case and no new deaths from 1 district. And this is an increase in the number of new cases since the last time that we had a briefing. The increase is by that 1 individual. So cumulatively, we have seen 20 cases, 9 which have been confirmed, and we have seen 3 deaths as a result of Crimean Congo hemorrhagic fever, and this gives us a case fatality rate of 20%. We have supported the government to activate district task forces to coordinate response, and surveillance has been enhanced at the community and in the health facility levels. And we are using the infrastructure we already have in place, including for COVID-19 and now for Ebola, and the knowledge that we are gathering during these 2 other outbreaks in Uganda to support that very important area of controlling Crimean Congo hemorrhagic fever as soon as is possible. Now, let me move then to the Conference for Public Health in Africa. We have only a few days remaining. In fact, tomorrow we start the youth pre-conference, where we are bringing together the youth, and the outcome interest has been fantastic. We are really looking forward to a very, very good meeting over the weekend. But when I look at, in general, the numbers for the Conference in Public Health in Africa, as I speak, we have 1,500 registrations that are completed, and another 2,000 are in the process. So essentially, the number of people who have initiated registration stands at 3,500. Those that have completed are 1,500. We have, apart from the main session, 56 side events which are in person in Kigali, starting from tomorrow. We have 56 in-person side events, and we have 10 virtual side events. So it is a very, very well subscribed conference, and we are encouraging those who have not yet registered to register and be there in Kigali, or at least join virtually so that you can be part of this very historic in-person conference of public health here on the continent. We are looking forward to having upwards of 50 dignitaries attending, ministers, heads of government, heads of institutions, and all this within the space of 3 or so days. We are looking forward to a very, very good meeting. Our co-chairs, Professor Agnes Binagwaho of Rwanda and Professor Senet Fisaha of the Susan Thompson Buffett Foundation, have done a fantastic job guiding this work. And we are very proud that a fully African meeting is actually now on the edge of achieving unprecedented success. And we are looking forward to sharing that, not just with Africa, but also with the world, because this is going to be a firm part of the annual calendar in public health. This conference of public health in Africa is going to be held annually around the end of the year, so that we can bring Africa together, we can bring public health experts together in one country or the other here on the continent of Africa. Finally is to invite you as journalists. We are going to be having a lot of engagement with journalists during the conference itself. And we are looking forward to you joining us on Monday for the conference briefing and daily briefings that we are going to be having. We are looking forward to you joining so that you're part of the conversation that is happening at the second International Conference for Public Health in Africa in Kigali, in Rwanda. Thank you very much, and back to you, Nick.
Thank you, Director. A rather succinct and comprehensive update covering COVID-19, the EVD situation, cholera, and the rest of it. And just closing on the CPHIA 2022, just set on the way. It's beginning tomorrow with the youth event. Fast forward to Monday until Thursday next week. And we are hoping that this section, our usual Thursday briefing, is going to be the climax of the engagement with the media. As you heard the director, starting from Monday, there will be a pre-conference briefing, and of course, a climax of the conference briefing in person with the director and other principals at the conference. So colleagues, you're invited. There's going to be a means to join digitally, while others are going to be there in person. Those of you who cannot make it, there's always a means that you can be able to be a part of the conversation, as the director said. So colleagues, we'll now move to the next session, as usual, of our briefing, which is the question and answer section, where you interact with the director by sending through your questions, and then he gives you the adequate response accordingly. So as usual, we've got 3 means through which you can send your question. The regulars on this briefing already know that we use, on the Zoom platform, we use the Q&A icon just at the bottom of your page. You just click there and write your questions. Remember, you have to indicate your institution, your name, and then the institution you work for. And then the second option on the Zoom platform is the raise hand icon. With that, once your internet connectivity is good, you can come directly. You can speak live on the platform. We'll give you that right. The third option for those who cannot use the platform is our usual WhatsApp number. That is +251 945502310. Let me read that again. +251 945502310. Just pick that number, send your question through that, and then we can be able to put that forward to the director. We already have a first question in our Q&A. Let me pick that up quickly. And this comes from our colleague Vera Okoye. And Vera just speaks directly to the issue of COVID-19. As you mentioned, several countries that have had successes in the issue of vaccinating their population. She says, what do you think the successful member countries did right to vaccinate their required population? That's the question from Vera. Over to you, Director.
Thank you, Vera. And of the different things that countries have done, 3 really stand out to achieve this success. The first is commitment at the leadership level. And I broaden it to leadership beyond political leadership, because we know other leaders in the private sector, within the community, have really been instrumental in the achievement of the 70% plus vaccination amongst the target population. So leadership has been very key. The political leaders, technical leadership, community leadership, private sector leadership, this has been very, very key in getting them to 70%. Second is proper engagement with members of the public. Countries where engagement with the public was consistent and very wide reaching have been much more successful in getting their vaccination rates to be high. So engagement with the public has been very, very key. Third is the sheer power of partnership. And here our role as Africa CDC becomes very important, because where countries have been open to productive partnerships in getting vaccines, in getting vaccination out, we have seen the numbers just rising. There are some countries that started late, but because of the very good partnerships that were built, we have seen the numbers just go up and the targets being reached within a very short period of time. So those three things: leadership at country level, engagement with the public effectively, and then a broad partnership that brings together all the players that contribute to improved vaccination rates at country level.
Thank you, Director. Colleagues, apologies for the breaking in the internet connectivity there. We're obviously going to share with you the recording of this section so that you can be able to reference in terms of the Director's response to your questions. So I will just link that to the question from our colleague, Eldad Paul-Rettard, who is with the East African correspondent for the National Public Radio in the US. Paul-Rettard just want to point out specific issues on the country, Tanzania. So he said, what can you say about Tanzania's response so far, holding to the fact that the country was slow in accepting the facts about COVID-19 early in 2021 and 2021?
No, thank you, Pauletta. And Tanzania is an example of a country where, although vaccination started later than other countries, but those three things I described confluenced together in a very, very productive way, and the numbers rose quite fast, looking at where Tanzania was about a year or so ago. So today, Tanzania is one of the countries that have achieved 70% of the target population, and we continue to work in Tanzania because there are pockets where the figures are still low, and we are working with the government there, providing support so that even those areas can be able to come up to at least 70%. And the same leadership that has been shown by the government there and the other leaders are still in play. Engagement with the public is very robust, and the partnerships that we have built within the country are also providing the much needed sustainable activities to be able to get even more people vaccinated. So Tanzania has done very well. Although they started late, they have actually hit the target before the end of the year.
Okay, so the questions are coming in segments, so we will keep on. There's one here from our colleague Benga Salu from the Guardian newspaper in Nigeria, just around, still around the issue of COVID. And he takes us back to the very early stages of COVID, where there was a conversation around the use of indigenous herbal medicine. So he wants to know if Africa CDC can give any update in terms of regulations or actions taken so far in terms of providing safety and efficacy for the use of indigenous herbal medicine in public health response in Africa.
Yeah, no, thanks, Alu. And as Africa CDC, we are very supportive of indigenous products for all types of diseases that we suffer from here on the continent. We are very supportive. What we do require is let us make it scientific so that we know and confirm the safety of these products and also the efficacy of the products to the specific disease entities that may benefit from the indigenous products. To date, what we are doing is we are working with the national authorities. Whenever a product has been brought to our attention, we work with the national authorities so that proper research is done, and we are supporting those national efforts to try and document the different indigenous products that can be helpful in the COVID and any other illnesses that we face on the continent. So we really encourage indigenous products, and we are working with the member states and the regulatory authorities to ensure that a proper documentation is being done, good research is being also done, and we can comfortably then be able to say that a product actually works or not. And this has been our position, attitude, and line of action since the beginning of this pandemic.
Thank you, Director. So there are two questions just around CPHIA. I will come to those questions like I spoke of the segmenting the question. So colleagues, just to remind you of the medium through which you can send your question. First, you can use the Zoom platform, the Q&A section. You can write in your question, indicate name and of course your institution. You can also use the raise hand icon if you want to come through live. And then of course, our WhatsApp number +251 94550 2310. So before I come to the questions related to CPHIA, let me take this question on Mpox from our colleague Kara Annan from, of course, the Associated Press, one of our regular colleagues on this platform. So Kara said, thanks for the briefing on Mpox. What role, if any, is Gavi playing in helping to get more Mpox vaccines to the African continent?
No, thank you. Thank you for that. At the moment, we are not engaged with Gavi since they do not have a stockpile of Mpox vaccines. We are dealing directly with other member states that have stockpiles of Mpox vaccines.
Okay, so let's move now to the segment on CPHIA. There are two questions in that segment. Let me start with the one from our colleague Lucio Blanco. Blanco is our colleague who normally joins from EFF, the International Spanish News Agency. She's based in Nairobi. Lucio say, many thanks for your time. Regarding the CPHIA, do you expect any major measures or decisions to be taken? And secondly, do you already have the list of heads of state that will be attending the conference?
Thank you, Lucia. By and large, conferences are not places to make major decisions, but they are places for us to discuss major ideas. And these ideas are then going to be translated into recommendations, and those recommendations, we are going to take them up after the conference is completed. So the conference is not for making decisions, but it is for discussion of major ideas and making recommendations, which will then be able to take forward. And there's a lot on the table that needs to be discussed over the 3 main days and over the additional 2 days of side events. In terms of heads of states, we are in touch with at least 4 different presidencies, and we expect representation. We expect heads of public health institutions, heads of philanthropies. So the agenda and the list of speakers is very rich, and I encourage you to be part of it, and you will be able to see which heads of states and which heads of institutions have actually come to give their messages at the conference.
Okay, More information is on CPHIA is obviously on the conference website. We can share that information with you just before the briefing comes to an end. Second question on CPHIA. This comes from our colleague David. David is from Radio 10 in Kigali. David is quite concerned about the economic side. He says, what are some benefits from your perspective that ordinary citizens of Rwanda stands to get from the event being held in the country?
No, thank you, David. There are a number of benefits to the ordinary Rwandan in the street. First is the visibility of the country. We have thousands of people coming in person, and we are going to have millions who are going to be engaged with the conference from different aspects globally. So the visibility of the country is very good, not only for the country, but also to the Rwandan who is in the street. Second is the number of visitors who are coming are going to engage with different services. They will eat, they will visit places, they will use services that are being given by the Rwandan on the street. So economically, there is a boost there because we have so many visitors that are coming. Third and last is the opportunity to network with international visitors. This is very key because then it opens up possibility for future partnerships and work, not just for institutions, but also for the Rwandan in the street. So we really encourage the Rwandan in the street to feel part of CPHIA and to support in every way that they can be able to do if they're in a position to do that. And I'm looking forward to enjoying the streets of Kigali as the conference days evolve from the weekend.
Okay, just one question still on CPIA is coming in our document here, and it says, you have been speaking of Africa's new public health order has been pushed by Africa's CDC. What role does CPHIA plays in realizing this new call?
Thank you. I didn't catch the name of the journalist, but the new public health order and the conference are really closely interlinked. In fact, the conference is the result of implementation of the new public health order. And in two major ways. One is that under Pillar 5 of the new public health order, where we say we want partnerships that are action-oriented and based on African priorities, the conference is going to be discussing those priorities and coming up with recommendations of what should be a priority on the continent. So it speaks directly to Pillar 5. The action-oriented part, we had committed that we want to bring African experts. We want to bring public health experts from the rest of the world to discuss African challenges here on the continent. And as an action, we have actually delivered on that. Last year, virtually, and this year in person. So from two different aspects, the Conference of Public Health in Africa is very closely linked to the new public health order. If you look at the rest of the pillars, issues around strengthening institutions, issues around strengthening workforce, issues around local manufacturing, issues around domestic financing, they are all major topics that are going to be discussed at the conference, and we expect that the recommendations that will come out of all these sessions are going to strengthen the way in which we continue to implement Africa's new public health order. Back to you, Nick. Nick, can you hear me?
Okay, I can hear you, Director. I think the last end of the sentence, to implement Africa's new public health order. So colleagues, I've sifted through our question menu here, and I don't see any new ones coming in. So with just under 7-8 minutes to go, we will do the usual and just turn the platform over to back to the director for his final key points, as usual, that he gives headline points for the media to take away. And after that, I'll give you a few announcements on CPHIA, and then we wrap up for today. So, Director, back to you for your final key 3 headline points for today's briefing. Over.
Yeah, thank you, Nick. So today, the 3 things I would like to share first is the progress that we've made with COVID-19 vaccination. And really, this is a testimony to the ability of the continent to come together and deliver. 44% of target population, where we had very low rates at the beginning of the year, is an excellent piece of news towards the end of 2023. So we encourage all of you, go get vaccinated. Those that are eligible, get boosted so that we can be able to keep the continent safer. So COVID. Second is Ebola outbreak in Uganda. As we do the countdown, we are on day 9. We are very pleased with the way in which partners have come round to support the response in Uganda. We are very pleased with the way the Ministry of Health and the government of Uganda have taken the leadership of ensuring that this particular outbreak is contained quickly. And we are very pleased with the individual frontline health workers who have put their safety and risked their well-being to be able to protect those of us who are not in the front line. Very proud of the work that they are doing, and we are looking forward to bringing this outbreak under control. Finally, is a conference. If you're not there in person, be there online. It is an event that you don't want to miss, from the youth conference, youth pre-conference tomorrow, to the main conference when it starts, to the side events. Be there in person. If you can't be there in person, be there online. Thank you. Back to you, Nick. Nick, you got the 3 points, and I think you may have frozen briefly there.
Okay, thank you, Director. Okay, thank you, Director. Thanks to all of our colleagues who have joined today's section. Very insightful questions, and of course, the responses adequately provided by the Director. Just a quick one on CPIA, just around the media. So as the Director said from the beginning, we are going to have a pre-conference briefing, just outlining what the week is going to look like, and that is scheduled for Monday evening at 5 to 6 p.m. Rwanda time. Is going to be at the Media Center in the Kigali Conference Center. The Director will be there in person. Our 2 co-chairs will be there, Professor Sanite and Professor Agnes. They're going to be there with the Director. And of course, the Honorable Minister of Health of Rwanda is going to join the 3 panelists. So those of you who will be present in Rwanda, that pre-conference briefing is going to be available at KCC. Just find us around the conference center and we can give you further information. In addition to that, just look on the CPHIA website, on the Twitter page or the social media handlers. There are a lot of information for the media there, and you can contact us as usual, and we can provide additional information that you will need. With that, we want to thank the Director for being available, considering the stringent travel schedule he has to brief us today. And to all of you who have made it your business to join today's briefing and get the information provided today. Thanks to our colleagues in the background, both at the African Union and of course at Africa CDC, doing everything to bring this briefing to us every week. Let's meet on Monday, this time for the pre-conference briefing at CPHIA, and then on Thursday for the post-conference briefing, just to wrap up on everything. Thanks to everyone. Let's do this next week and see you in Kigali next week. Bye-bye from us.
Recording stopped.